Hi, in this video we are going to talk about health insurance in Indonesia.
To be very honest, we never really seriously researched the types of health insurance when we were living abroad. Either our employer arranged it or we had travel insurance. But now, after doing a lot of research about health insurance, we realized that you must have a proper health insurance when living abroad.
So let's have a look at why good health insurance is important when living in Indonesia and how much it will cost you per month. First of all, let's just go straight to the question. Do you even need health insurance when living in Indonesia?
Yes, you definitely do. You might think you don't need health insurance because you're healthy and young, or that medical care is not that expensive in Indonesia, making it easier and perhaps cheaper to just pay straight up after a doctor's visit or treatment.
But investing in good health insurance is one of the most important things you need to do when living abroad. You just don't want to be stressed out if you do need intensive care.
Exactly, especially in a country such as Indonesia. If you are feeling sick, you just want to be sure that you'll be taken care of as soon as possible. And we're not talking about accidents that can happen, but you can get all kinds of diseases when living in Indonesia. Just think of tropical diseases such as malaria, dengue, or even diarrhea that can torture you for more than a week.
Yeah. Believe me, when living in Indonesia, you will get never-ending diarrhea at some point. Making you dehydrated and very weak. Monica and I both ended up at the doctor's at one point after trying all sorts of pills and sachets. So when living in Indonesia, you can expect that you will need to get medical treatment sooner or later, right?
Definitely. But how is the overall healthcare in Indonesia? If you're looking at statistical numbers, then you can base the quality level of healthcare in Indonesia on the so-called healthcare index. The healthcare index indicates the overall healthcare system of a country, and it includes the healthcare infrastructure, the professionals and their skills, costs, quality of medicine, but also the access to clean water, sanitation, environmental well-being, and so on.
Yeah. So for instance, this year in 2023, Taiwan is ranked number 1, followed by South Korea, Japan, France and Denmark. The United Kingdom was ranked number 10 and the United States ranked number 35. So how about Indonesia? Indonesia is number 56 of a total of 85 countries.
This doesn't necessarily indicate that the healthcare in Indonesia is of poor quality because, as mentioned, all kinds of factors are included, such as access to clean water and so on. Yeah. But when you know that Indonesians, if they can afford it, rather fly to Malaysia or Singapore to get their medical treatment, then you don't need a healthcare index to get an idea of how it is. For example, my uncle would fly from Jakarta all the way to Singapore for treatments.
Yeah, that's right. So I think that if local people seek medical care in another country, then that's a good enough indication of how healthcare is in a country. Makes sense. Of course, we are not saying that when you are sick and need to visit a doctor, you immediately have to hop onto a plane to Singapore for checkups. If there are emergencies or common illnesses, you should go to a medical center in Indonesia first, of course.
Yeah, definitely. For instance, Matt was bitten by a dog once and my eardrum broke during a surfing attempt. And yeah, of course, we went straight to the doctor in Indonesia. And these visits are so cheap that we didn't even bother to use our health insurance.
No.
Instead, we just paid everything up front. It was never more than $100, except for that time when my 4 wisdom teeth had to be extracted, which cost me about $300.
Yeah. We do have to point out that if you're from Jakarta or Bali, they have decent hospitals, These hospitals are going to give you excellent medical care and the staff also speaks English. But in other parts of Indonesia, we wouldn't run the risk, right?
No. For instance, in Kalimantan, a colleague of mine had malaria and was hospitalized for a couple of days. The hospital had just basic facilities, no air conditioning or proper windows, and I had to arrange the medicine that the doctor administered. Luckily, soon after, she was flown back home to Australia to fully recover.
Depending on where you are from, you will also notice that medical treatment in Indonesia can also be different than at home. We are from the Netherlands, so we are used to a type of medical approach in which Dutch doctors always prescribe 2 weeks rest first before returning to get any type of treatment. It's really difficult to convince the doctor to prescribe medicine or a referral to a specialist here in the Netherlands.
Yeah, and in Indonesia, we feel like doctors love to prescribe as much medicine as possible, even for minor things.
Yeah.
They will come up with a whole list of pills that you should take, and one of them is very likely going to be antibiotics, something we hardly get prescribed here in the Netherlands.
Yeah, very difficult.
So in some cases, when living in Indonesia, we headed home from the doctors and we always wondered if we had received the correct treatment or diagnosis or not. So we were always unsure if we should take the prescribed medicine.
Yeah. But what we do like about healthcare in Indonesia is that you can do a thorough body checkup whenever you want. Also, you can walk into any dental practice to have your teeth cleaned and so on. As long as you can pay upfront, there's a lot of choice in receiving care. And it's pretty cheap.
So what type of healthcare insurance do you need? As a foreigner, you are likely not eligible for national insurance, so you will need to arrange your own. Often you need to be a registered citizen to get national insurance.
Yeah.
And if you are able to get local health insurance, you might end up in low quality hospitals and are not entitled to have treatment abroad.
So what are the other options? First of all, you need to be aware of the difference between international health insurance and travel health insurance. When you decide to live in Indonesia for an extended period of time, you should arrange international health insurance so you can receive care abroad, such as long-term treatments, dental care, vaccines, operations, and maternity care. Travel health insurance will only provide emergency treatment in the short period of time you are abroad. When you decide to travel while living abroad, then you should arrange travel insurance as well. The downside of international health insurance is that it can be really expensive.
Somewhat cheaper insurance is a so-called digital nomad health insurance, which is a combination of both health insurance and travel insurance. It usually does have less medical coverage than international insurance, but often a good option for those not staying in a country for a longer period of time. If you are actually planning to live in Indonesia long term, then you should arrange an international health insurance.
Yeah. So, how much does international health insurance cost? Pretty important question, of course. When coming to the cost of international health insurance, we would suggest not looking at the cheapest, but finding one that covers all your needs, such as the option of receiving medical care abroad in countries such as Singapore or Malaysia. Imagine living in Indonesia and you want a checkup because you think you have something serious. Then you would want to get the best health care, right?
So if you want to have the choice to seek treatment in another country than Indonesia, then medical evacuation should be included in your health insurance clause. There are a lot of insurances that provide international health care, such as Allianz, AXA Global Health, Cigna Global, Willem Russell, IMG Global Plan, and so on. But as mentioned earlier, international health insurance is not cheap.
Yeah. We got various quotes online, but the insurance depends on your nationality, the amount of coverage, age, sometimes height and weight, and if you're a smoker, yes or no. Also, some insurances have various types of plans, such as bronze, silver, and gold. Luckily, Indonesia isn't the most expensive, so the insurance will not be as much as if you would move to Hong Kong or Singapore. That said, it's not a bargain either. We looked online for prices, but most of the insurances require a call to get a quote. We did, however, find this great website that show prices. Unfortunately, it is only possible to check for a single person, but it's a great start to get an indication of how much to expect.
As you can see, the cheapest option for me was from A Plus International Insurance, which was $68 a month for inpatient and outpatient care, emergency evacuation and emergency repatriation, with an annual limit of 200,000 US dollars and a deductible of 5,000 US dollars. But remember, the cheapest is also the most limited. So if you do it, you have to do it right.
Yeah.
If you would select a well-known insurance such as Cigna, then it will be much more expensive, from 163 US dollars per month up to 590 US dollars or more, depending on the plan.
All right. In the Netherlands, we did find one where we could easily get a quote for the three of us. Regular coverage would be 352 euros with an excess of 1,000 euros. Comfort would be 507 euros with an excess of, 1,000 euros, right?
It is tempting to go for the cheapest plan, but as mentioned, these plans are often very limited and will not give you the coverage you may need. So remember that you should not save on international health insurance. If it is too much for your monthly budget for living in Indonesia, then perhaps you are financially not ready to move there yet.
Yeah. For us, we will be calculating around 550 US dollars a month for just our insurance. It's almost just as much as we pay here in the Netherlands. It's a huge amount compared to the other costs of living in Indonesia, but it is good to know before you actually start packing.
As you can tell, health insurance will be one of the biggest costs of living in Indonesia for us. In our previous video, we had already calculated our monthly fixed cost of living in Indonesia, which was 1,200 US dollars, and plus the cost of food, which is 550 US dollars. And with the insurance included, we come to a total of 2,300 US dollars.
Wow, that's a lot. And we haven't even added visas, school and our trips away and other expenses we expect to have. We will be covering these costs of living in Indonesia in our next video. So if you want to know what the total will be, make sure you subscribe to our channel to see our upcoming videos.
Also, please leave a comment if you have ideas or stories to share with us. And of course, press the like button if you thought this video was useful.
Thanks again for watching till the very end and see you in one of our other videos. Bye bye!
Bye bye!